Assalamualaikum and greetings to Prof. Tainal. My name is MAZLIFAH binti MUKSIL, BM24.10089. So, my seminar is about cardiologist, which is a specialist in heart and circulatory system. So, about cardiologist. What is cardiologist? A cardiologist is a doctor who specializes in diagnosing, treating, and preventing diseases and conditions related to the heart and blood vessels. They focus on maintaining heart health and managing cardiovascular disease. So, for the best cardiologist in Malaysia that inspired me the most is Datuk Dr. Rosli Muhammad Ali, is a senior consultant cardiologist at the Institute Jantung Negara. He is a highly respected consultant cardiologist known for his dedication to advancing cardiac care and his exceptional patient-centered approach. Okay, move on to the next slide. For the anatomical structure of the heart. Heart contains of 4 chambers, which is right atrium, right ventricle, left atrium, and left ventricle. Heart have 4 valves, which is tricuspid valve, pulmonary valve, mitral valve, and aortic valve. Tricuspid located between right atrium and right ventricle, pulmonary between the right ventricle and pulmonary artery, mitral valve between the left atrium and left ventricle, lastly aortic valve between the left ventricle and aorta. So major blood vessels here are aorta, pulmonary arteries and veins, and vena cava. Layers of the heart wall is epicardium, myocardium, and endocardium. What about the conduction systems of the heart, which is the heart's rhythm is regulated by SA node, AV node, and bundle of his Purkinje fibers. For SA node, this represents a pacemaker that initiates electrical signals, and then electrical signals from SA node is transferred to the AV node. At the AV node, there is a delay for the signals before passing it to the ventricles. And the bundle of his and Purkinje fibers, which is distribute signals for coordinated contractions. These complex structures ensures efficient blood circulation, delivering oxygen and nutrients while removing waste product. And then next is ECG. ECG is electrocardiogram. ECG is performed to assess the electrical activity of the heart. Alright, so what happened at the P wave? P wave represents SA node, which is atrium will depolarize, atrial depolarization. So atrial will contract, starts at 100 milliseconds after P wave begin. And then, as you guys can see at this ECG diagram, PR interval is a time interval for impulse to go from SA node to AV node. And then, next is QRS complex. QRS complex is a ventricular depolarization. So Q happens when depolarizations of interventricular septum, and then R, ventricular depolarization, and S, last phase of depolarization toward base of the heart. And then the T wave is a ventricular repolarization, which is before the ventricular will diastole. Okay, and then QRS interval is a time interval for impulse to go from AV node to stimulate Purkinje fibers, which is less than 0.12 seconds. And then QT interval is a time interval for beginning of depolarization to the end of repolarization of ventricle. And then ST segment, it is end of the S to the beginning of the T. Alright, next is the action potential of the pacemaker tissue and the ionic bases. Okay, so pacemaker tissue, which is mainly located in the SA node of the heart, is responsible for controlling your heart rate by sending out electrical signals. These cells can generate electrical impulse on their own, even without external stimulation. Okay, so for phase 4, which is known as resting phase, pacemaker cells are never truly resting. Instead, they gradually become less negative inside, and this is called depolarization. This happens because of sodium ion and calcium ions slowly moving into the cells. It's like a gentle push that starts to get the cell ready to fire an electrical signals. And then, for phase 4, it is represented that the action potential starts to begin. Once the cells becomes less negative enough, it hits a certain point called the threshold. At this point, calcium channels open up and let in a lot of calcium ions. This causes the inside of the cell to become very positive very quickly, which is the rapid part of the action potential called depolarization. Move on to the phase 3, which is repolarization. After the rapid spike in positivity, the cell needs to return to its resting state. This happens when potassium ions flow out of the cell, making the inside more negative again. This is called repolarization. And then this thing will keep repeating. The cell then slowly starts the process all over again, gradually becoming less negative and preparing to send out another signal, keeping your heart beating regularly. The pacemaker cells in the heart work by letting sodium and calcium ions move into the cell, to start the electrical signal, and then letting potassium out to reset the cell. This cycle of ions moving in and out makes the heartbeat in a regular rhythm. So moving on to the disease, which is the famous disease, coronary artery disease. This disease is a type of heart disease involving the reduction of blood flow to the cardiac muscle due to the buildup of atheromatosis plaque in the arteries of the heart. It is the most common of cardiovascular disease. This disease happens when coronary arteries struggle to supply the heart with enough blood, oxygen, and nutrients. Symptoms of the coronary artery disease can cause chest pain, shortness of breath, neck and jaw tightness, fatigue, and high risk of heart attacks. But this disease can be treated by angioplasty or coronary artery bypass. Okay, so first of all, angioplasty is a medical procedure used to open up blockage or narrow blood vessel. How angioplasty works? First of all, there is a insertion of catheter. Catheter is a thin tube. It will insert to the blood vessel, usually through the groin or wrist. And then, when it's inserted to the blockage, this will happen a balloon expansion. At the tip of the catheter, there is a small balloon. Once it reaches the narrow part, the balloon is inflated. This will compress the fatty deposits against the artery walls, widening the artery and improving blood flow. Lastly is coronary artery bypass. So in the bypass surgery, doctors use a healthy blood vessel from another part of your body, like leg or chest, to create a new path for blood to flow around the blocked artery. So this can be done when the doctor makes an incision in the chest to remove the blood vessel and attach it to the heart to bypass the blocked area. Alright, so that's all from me. Thank you.